Through the waters rushing on, there can be no power greater anywhere beneath the sun. Yet what was on earth is greater than the feeble strength of one. For the union makes us strong. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong.
Viva! Can we do viva?
Viva!
Long live union, long live!
Long live!
Thank you.
And, we had a Bilabia Kamkunji with doctors from Kiambu who have been on a 55 days strike, or 58 days strike today. And we have come here sympathizing extremely with the residents of Kiambu. We don't know to whom did they do wrong, or to whom have they not worshipped in the right way, to the point that their former governor has been arraigned in court because of the public fund that otherwise should be helping them. And even the current leadership is not in any way safe because the EACC is raiding it strongly. At the same time, when billions of shillings have been allocated to the county, we are worried that that is happening, and the cornerstone of health services in the county have been out of work for 58 days without any concerns from the county. The doctors have been on strike because they have not been promoted despite the return to work agreement last year that was adopted in court. Their medical the medical insurance is not working, and therefore most doctors in Kiambu County are not able to afford the services that themselves are offering. The statutory deductions are done in the payslips, including the banks, but they're not limited. That these doctors, when they raise their voice of the issues of injustice, the injustice of lack of drugs, of lack of equipment, that they need to be supported over the services, they get arbitrarily transferred to different hospitals. They are delayed salaries to the point that the doctors keep on selling the little properties that they have. They have been unable to make fuel cars to go to work. The rents, we have landlords knocking every day. So these are the mere injustices that have made the doctors say enough is enough, and there's no way they will go back to work if these issues are not resolved. The shortage, they can't even go on leave. The court last week pronounced itself on the issues of Kiambu, and the court has protected this strike. The judge, in his wisdom, said that negotiation will go on while the doctors are on strike. The principal judge declared last week that there's nothing tying his hand now to declare that the county managements are in contempt, because all the issues we are demanding were court-ordered. And therefore we are, as much as we are negotiating, as much as we are on strike, the individuals who are responsible for it are actually being subjected to criminal offense because they have not complied to court orders. Therefore the union is demonstrating and saying we will not proceed to go back to work unless these issues are resolved. We will not in any way go back to work if we don't see goodwill that is demonstrated by goodwill, not by word of mouth by politicians. And that's why this strike will continue. We have also expressed our concern in the matter of the murder case of a patient in Kenyatta National Hospital. And we are saying it is not only unique to Kenyatta. There are many level 5 and level 6 hospitals across the country where patients are left in devastating situations. Patients are left frustrated in the wards, where we know that in level 5 and level 6 hospitals we have critical patients that need nursing care, that need doctor's attention all the time. And when wards are left to run without the healthcare workers, it means that we are losing patients that otherwise would be saved by drugs. We are losing patients that otherwise would be done for procedures. We are losing patients out of neglect of the hospitals not employing healthcare workers. So the case in Kenyatta National Hospital is because of the shortage of doctors, because of the shortage of nurses. That's why a criminal will walk freely in the world and do those particular and commit such criminality, because there's no nurse, there's no doctor, there's no person to identify and see this particular criminal. Why? Because they've not been employed. So as long as we have shortages in level 6 hospitals, there are many cases, there are many patients, there are many people who actually dying in otherwise death that will be protected. We want to say that there's need for surveillance, there's need for security in hospitals, level 5, level 6. But there will never be any security if we continue having shortages. This happens in level 5 hospitals, this happens in level 6 hospitals, and therefore the government, in all its way, both the county government and the national government, must ensure that we employ healthcare workers, that these healthcare workers that are employed and the patients in those hospitals are safe. And safety means that we should not have an ward that has only critical patients without healthcare workers in it. We have also declared today that we have a demonstration scheduled for this week on Thursday in Kiambu County to dramatize the injustice of the county, to illustrate the need for county to act now. And we are calling the residents of Kiambu County that we are not doing this for doctors. We are doing this for you. Because if you go to a hospital and there are no doctors, it means that you will be frustrated. We have also declared today, that all the 150 interns in Kiambu County have to be withdrawn by the ministry. We've read the Minister of Health, who I believe is very progressive. These interns need to be taken to other places where they can train and can be doctors, where they can actually be equipped with the skills that are needed, rather than being played with in the county that does not need doctors. We have also indicated that we're going to have a special National Advisory Council to discuss the intricacies of the issues of Kiambu. And we are saying, the time has come where we will not see Kiambu as Kiambu alone. Because as a union, we are one union. As a country, we are one country with one treasury, with one exchequer. And therefore, when one employer becomes belligerent, all the doctors in this country will turn down to deal with Kiambu County. And we are saying today that if this issue is not resolved, we are ready to escalate it to national action. Thank you.